Hello, I'm Dana Cowley. Welcome to Charter Local Edition Northwest. Today we're in Salem talking to our elected representatives, and my guest today is Senator Alan Bates, serving the Medford area. Senator, thank you so much for joining us.
Thank you for having me.
We really appreciate you being here and sharing with us what's being done to help give affordable health care to the people of Oregon.
Well, probably the biggest change we've seen since Medicare and Medicaid back in the 1960s is occurring right before our eyes. And the focus, unfortunately, has been on the wrong part of the program. The focus in the media, and especially in newspapers, has been on the IT portion of it, which has not done well. It's now rolling out, starting to function. People can now sign up for this new coverage under IT, but it's just getting started. It's 3 or 4 months late getting that out. But the real story here is that we've insured about 230,000 Oregonians who didn't have health insurance December 31st, but have it now. And that is a huge change for us. A lot of them are in the Oregon Health Plan, some are on commercial insurance. Bottom line is they're going to get first-rate health care for the first time in their lives. I'll give you a couple of examples of that so you can understand it. We have patients in our practice who are coming to us in their 50s and 60s who have never had a colonoscopy, haven't had a mammogram, haven't had a physical exam in 10 or 15 years because they couldn't afford it. Now they're getting those done. It's going to save lives. I was talking to one of our GYN specialists in Medford recently, Dr. Haglock, wonderful physician. She's telling me that the Affordable Care Act and this rollout and getting all these people insured has done more for women's health care than anything she's seen in her 30 years in practice. So people are getting in. It is. I mean, they're getting in and cancers are being found early. People's lives are being saved. And we're not telling that part of the story yet. Our goal was to sign up about 250,000 people by the end of 2014. We're at about 230,000 already. We got another month or so to go to sign up more. Then there'll be a close of the open enrollment. And from that point on till next October 1st, you can't enroll in the commercial side, but we'll still be enrolling people in OHP. We really hope to hit 300,000 by the end of the year, which is a huge number for this state.
That's a big change.
It is a huge change. And when we look at other states and how they're doing and how we're doing with them, we're about 4th or 5th in the nation as far as a number of people signed up for health insurance that weren't signed up before on a population basis. So we've made huge strides here. And we're trying to kind of adjust to all that. I mean, the precepts we used to treat people before often, can you afford to do this, can you afford to get that, or you order something for a patient, they say, Doc, I can't afford to do that. Right. I can't get that MRI done, I can't get that colonoscopy done. So the life is changing for these people. We're going to have a healthier population, we're going to save lives, and in the long run, because everyone's going to be insured, we're going to start bringing healthcare costs down. And it's going to take a while for that to roll through the system, and it's going to be a lot of bumps along the way. But I think a year from now, if you and I have this conversation, people will understand it better. They'll have friends and neighbors who for the first time are getting taken care of properly, and I think they'll be very happy with it. But it's going to be thumpy and bumpy as we go along here for a while.
Yeah, these are big changes, and we only have about 30 seconds left, but when I talk to the healthcare providers, and you are a doctor yourself, a lot of unknowns here. So what is this like on the healthcare provider side? On
the provider side, most of us, especially in primary care, are happy about this. We're now seeing patients who we can order medications for, and they get the prescription filled. They can get the imaging done we want, and we can make the proper diagnoses.
Thank you, Doctor.
Thanks.
Appreciate you joining us.
Thank you
for
having me.
This is Senator Alan Bates. I'm Dana Cowley, and you're watching Charter Local Edition Northwest.